Bismillahirrahmanirrahim. Assalamu alaikum students. Today I will be very briefly discussing with you important functions of kidney. Students, kidney as an organ perform two basic types of functions. Endocrine functions as well as exocrine functions. First we go through endocrine functions. The endocrine functions of the kidney include, most important is production of an hormone renin. Students, renin plays an important role in maintaining blood pressure and fluid balance in the body. Angiotensinogen, which is present in human blood, is converted into angiotensin 1 by this enzyme renin. Okay, angiotensinogen is converted into angiotensin 1. This angiotensin 1 is converted into angiotensin 2 by the enzyme angiotensin converting enzyme. Now angiotensin 2 leads to increased sodium and water retention in the body, increased production of antidiuretic hormone and aldosterone hormone secretion. Students, all these factors leads to elevation of blood pressure and increased perfusion of the kidneys. After renin production, we move towards second important endocrine function, that is production of erythropoietin. As the name indicates, students, erythropoietin is necessary in the process of erythropoiesis. What is erythropoiesis? In very simple words, the production of red blood cells from the precursor cells is called erythropoiesis. Now, secondary hyperparathyroidism. Students, this endocrine function of the kidney is indirect. How it is indirect? Kidneys are involved in hydroxylation of vitamin D3, which is a precursor of vitamin B. Students, in any kidney disease, this hydroxylation of vitamin D3 is reduced. As a result, there is an imbalance in calcium and phosphate metabolism in the body. This phenomena leads to increased production of parathyroid hormones, which try to correct the calcium and phosphate levels in the body. Now, next function is prostaglandin metabolism. Students, you all know that prostaglandins are pro-inflammatory. That is, they cause inflammation. Second, they produce vasodilation, increased internal diameter of the vessels. So, prostaglandin metabolism is affected when there is any kidney disease. For example, prostaglandin E2 and prostacyclin I2 production is decreased. As a result, there is vasoconstriction, which leads to fluid imbalance and blood pressure abnormalities in the body. Fifth function is gastrin metabolism. Students, gastrin is directly related with production of hydrochloric acid in the stomach. When kidneys are pathologically involved, they are not functioning properly, this gastrin production leads to increased production of HCl or vice versa. Next is gluconeogenesis. Students, this main process is usually carried out in the liver, but a small proportion of gluconeogenesis also takes place in the kidneys. So, when kidneys are not functioning properly, this process of gluconeogenesis is disturbed. The seventh endocrine function of kidneys is production of thrombopoietin. Students, thrombopoietin are necessary for the production of platelets. When kidneys are not performing their functions normally, this thrombopoietin production is decreased. As a result, platelets count are decreased in chronic liver diseases. Urodilating. Students, urodilating, it is a ANP, atrial natriuretic peptide. Kidney leads to increased production of urodilating. When there is decreased production of urodilating in kidney abnormalities, there is decreased production of sodium and water in the body. There is increased diuresis. All these leads to lowering of blood pressure and fluid electrolyte imbalance in the body. Now students, exocrine functions of the kidneys. Exocrine functions are two basic functions of the kidneys, that is, number one, excretion of nitrogenous waste from the body, and number two, urine production. These are the two main exocrine functions of the kidneys. Please take a closer look of these endocrine and exocrine functions of the kidneys. Thank you students. Allah Hafiz.